What if I told you that lung cancer is often one of the deadliest cancers, not because it's impossible to treat, but because many people don't know they have it until it's already advanced? The good news is that when lung cancer is found early, treatment can be much more successful, and in many cases, lives can be saved. Today we're going to cover everything you need to know, from early detection, lung nodules, warning signs, testing, cancer stages, and the latest treatments for both non-small cell and small cell lung cancer. Stay with me until the end because this information could save your life or the life of someone you love. What is lung cancer? Lung cancer begins when abnormal cells inside the lungs grow out of control. Instead of dying and being replaced by healthy cells, these abnormal cells continue multiplying and eventually form tumors that interfere with normal lung function. Lung cancer is one of the leading causes of cancer-related deaths worldwide. However, advances in screening, surgery, targeted therapies, immunotherapy, and newer medications have dramatically improved survival for many patients, especially when diagnosed early. Can lung cancer be found early? Yes. In fact, finding lung cancer early is one of the biggest factors that improves survival. Many early-stage lung cancers cause no symptoms at all. That's why doctors recommend annual low-dose CT scans for people at high risk. You may qualify for screening if you are between approximately 50 and 80 years old, have a significant history of cigarette smoking, often 20 pack years or more, currently smoke or quit within the last 15 years. These low-dose CT scans can detect tiny lung cancers before symptoms appear. Early detection can literally be life-saving. What causes lung cancer? The biggest cause is cigarette smoking. Smoking damages the DNA inside lung cells over many years. But smoking is not the only cause. Other causes include secondhand smoke, radon gas exposure, asbestos, air pollution, diesel exhaust, exposure to certain workplace chemicals, prior radiation to the chest, family history, and certain inherited genetic mutations. Some people who have never smoked also develop lung cancer. What are the risk factors? Your risk increases if you smoke cigarettes, use cigars or pipes, have chronic lung diseases like COPD, have a family history of lung cancer, are exposed to radon gas, work around asbestos, arsenic, silica, or diesel fumes, have increasing age. The more risk factors someone has, the greater the chance of developing lung cancer. What are lung nodules? One word that often scares people is lung nodule. A lung nodule is simply a small spot on the lung. Most lung nodules are not cancer. They may be caused by old infections, scar tissue, inflammation, benign growths. Doctors look at size, shape, appearance, growth over time. Small nodules often just require repeat CT scans. Larger or suspicious nodules may need additional testing, such as a PET scan or biopsy. Finding a lung nodule does not automatically mean someone has cancer. What are the signs and symptoms? Early lung cancer often has no symptoms. As cancer grows, symptoms may include a cough that won't go away, coughing up blood, chest pain, shortness of breath, wheezing, hoarseness, recurrent pneumonia, frequent bronchitis, fatigue, weight loss, loss of appetite. If cancer spreads, symptoms can include bone pain, headaches, weakness, dizziness, seizures, swollen lymph nodes, yellowing of the skin. If the liver becomes involved, persistent symptoms should always be evaluated by a healthcare provider. How is lung cancer diagnosed? Doctors use several tests. These may include chest X-ray, low-dose CT scan, diagnostic CT scan, PET scan, MRI, especially for the brain if spread is suspected, bronchoscopy, needle biopsy, surgical biopsy. Once cancer is confirmed, doctors also perform molecular and genetic testing on many tumors to help determine the most effective treatment plan. What are the types of lung cancer? There are two major types: non-small cell lung cancer, NSCLC. This accounts for about 85% of lung cancers. It generally grows more slowly. Small cell lung cancer, SCLC. This is more aggressive. It grows quickly and often spreads earlier. Treatment approaches differ between these two types. What are non-small cell lung cancer stages? Stage 1. Cancer is only inside the lung. No lymph nodes are involved. Treatment often includes surgery. Some patients may also receive chemotherapy depending on their risk. Many patients diagnosed at this stage have excellent outcomes. Stage 2. Cancer is larger or has spread to nearby lymph nodes. Treatment usually includes surgery, chemotherapy, sometimes immunotherapy, sometimes radiation. Stage 3 cancer has spread to nearby lymph nodes or nearby structures. Treatment often includes a combination of chemotherapy, radiation therapy, immunotherapy, surgery in carefully selected patients. Many patients require treatment from a multidisciplinary cancer team. Stage 4. Cancer has spread to distant organs. Examples include brain, liver, bones, adrenal glands. Treatment focuses on controlling the disease, relieving symptoms, improving quality of life, and helping patients live longer. Many patients now receive immunotherapy, targeted therapy, chemotherapy, radiation, surgery in selected situations, clinical trials. Some targeted medications have dramatically improved outcomes for patients whose tumors carry certain genetic mutations. What are the treatments for small cell lung cancer? Small cell lung cancer behaves differently. Treatment often includes limited stage chemotherapy, radiation therapy, sometimes preventive brain radiation in selected patients after a good response. Extensive stage, when cancer has spread beyond one side of the chest. Treatment usually includes chemotherapy, immunotherapy, radiation for symptom relief when appropriate. Although small cell lung cancer can respond well initially, it may return, making close follow-up important. What treatment options for non-small cell lung cancer treatment depends on the cancer stage and specific tumor characteristics. Options include surgery, may remove part of the lung, one lobe, lobectomy, an entire lung in selected patients. Chemotherapy uses medications to destroy rapidly dividing cancer cells. Common side effects may include fatigue, nausea, hair loss, low blood counts, increased infection risk. Many side effects can be managed with supportive medications. Radiation. Therapy uses high-energy beams to destroy cancer cells. It may be used before surgery, after surgery, instead of surgery to relieve symptoms. Targeted therapy. Some lung cancers have specific genetic mutations, such as EGFR, ALK, ROS1, BRAF, MET, RET, KRASG12C, or others. If these changes are present, targeted medications may work better than traditional chemotherapy for some patients. Immunotherapy. Immunotherapy helps the immune system recognize and attack cancer cells. For many patients with advanced non-small cell lung cancer, immunotherapy has significantly improved survival and quality of life. A diagnosis of lung cancer is frightening, but today's treatments are better than ever before. The most important message is this: don't ignore persistent symptoms. If you're at high risk, ask your healthcare provider whether you're eligible for annual low-dose CT lung cancer screening. Early detection can make a tremendous difference. Knowledge, regular medical care, and timely treatment save lives. This video is intended for educational and informational purposes only and should not be considered medical advice, diagnosis, or treatment. Always consult your physician, pulmonologist, oncologist, or another qualified healthcare professional regarding any symptoms, concerns, screening recommendations, or treatment decisions. Never delay seeking medical care because of information presented in this video. If you are experiencing severe chest pain, coughing up significant amounts of blood, or difficulty breathing, seek emergency medical attention immediately. If you found this video helpful or learned something new, please follow, like, share this video with your family and friends, leave a comment below, and subscribe so you don't miss future videos covering important medical topics that could help protect your health. Thank you so much for watching, and I'll see you in the next video. Stay healthy, stay informed, and take care of yourself.